Hello, my name is Christina Vu, and I am part of the Health Needs RX team. We are a new organization with a mission to empower people to make their healthcare decisions. We create video content and information guides on essential topics like chronic diseases, mental health, respiratory illnesses, health literacy, and more to help people optimize their health. Today, I'm joined with Nurse Ingrid Bail, who is a hospital care nurse, and we will be discussing more regarding terminally ill elderly patients that are diagnosed with cancer. Thank you for joining us today. What made you want to become a hospice care nurse compared to a registered nurse seen in the hospital?
First of all, I think nursing is my calling. So since I was a kid, I always wanted to be a nurse. All the family members are in healthcare. But prior to that, prior to becoming a hospice nurse, I actually worked as a rehab and dialysis nursing. So I did that for a little over 2 years, and then I switched to hospice. And funny enough, because it was actually my boyfriend who encouraged me to do hospice. Um, like many other healthcare professionals, I didn't really know anything about hospice. I thought it was just about, taking care of just dying patients and all that. So I was kind of second guessing myself, I guess, but I actually fell in love with it.
What is the purpose of hospice care for terminally ill patients?
Hospice care is a type of service, and we care for obviously terminally ill patients. So these patients are diagnosed to have 6 months or less, uh, 6 months or less to live. But the main goal of hospice care is to help patients and their family physically, emotionally, spiritually, and mentally, and for them to be comfortable and promote quality of life by helping, manage their pain and the other symptoms.
For those who cannot afford hospice care, is there any other alternative care one can receive?
You know, Hospice care is actually covered 100% by Medicaid, but it is also covered by almost all of health, almost all of the health insurances out there.
Are there any recommendations for at home treatments or care a family member can do if hospice care is not an option?
Hospice care is a service that we provide in the home of the patient. So it could be, their private homes, it could be a group home, assisted living, hospitals, and skilled nursing facilities. So although there are some hospice companies that have their own inpatient unit, like for us, for instance, my company has a 12-bed facility, which is what we call the inpatient unit. So by that, we care for our patients basically anywhere they call their home. Many people think that hospice care is a place, but it is actually a type of service. So like the RNs, CNAs, nurse practitioners, and doctors, even chaplains and social workers and volunteers, we all go to the patient's home to provide care. So also as RNs, we usually visit our patients, let's say 1 to 2 times a week, depending on the case of the patient. But for CNAs, they have to go to the patient's home more than us. So let's say they can go 3 to 5 times a week. And for chaplains, social workers, they can go once a month to assess and see what their needs are, and then they can adjust their schedule then.
What are some treatments hospice care provides for patients that are diagnosed with cancer?
Cancer patients are hospice appropriate. They are usually patients who refused any further aggressive treatments, such as chemotherapy, surgeries, or radiation therapy. And they also have very poor survival rate despite those treatments. So as hospice care providers, we provide care and manage their symptoms, and we basically just keep them more comfortable. But obviously, if they have wounds that needed to be taken care of, we also take care of that. We also do, Foley catheter. We also do, let's say, we used to do paracentesis. So, we remove extra fluid in the body, but we do that in our inpatient unit. We cannot do that in the home of the patient. So not a lot of hospice company not a lot of them have their own inpatient unit. So I am fortunate enough to be, in a team with that kind of benefit to our patients.
How can hospice care strengthen cancer patients emotionally, physically, and spiritually in their last moments of life?
So a team of different disciplines such as nurses, doctors, chaplains, social workers, and volunteers, we all work together. So every week we get together and then we have a meeting and we talk about our patients, we talk about their needs. We don't only take care of our patients, but we also make sure that we take care of their families because at this stage of life, it is very difficult. And, our aim is to help in any way we can, basically.
Are there any daily screenings or checkups these cancer patients have during their time in hospice care?
So there are no daily screenings or checkups for our cancer patients or other patients, but the nurses, we visit the patient 1 to 2 times a week, depending again on the patient's needs. And we do take their vital signs and we do obviously our nursing assessments. And then whatever their needs are, then we try to meet them.
Is it possible for patients who have cancer to improve during their time in hospice care?
I don't really think our cancer patients improve because in hospice care, we don't do any aggressive treatments. However, depending on the type of cancer, some patients may live longer than 6 months, but that doesn't mean that we have to, stop hospice care. So we do, though, discharge our patients from hospice if we think that they are not declining, which is actually good. With that being said, we do recommend them or refer them to, let's say, home health or palliative care.
Is hospice care a permanent home situation for terminally ill patients?
So, as I mentioned earlier, hospice care is provided anywhere the patient considers to be their safe home. However, some hospice companies they have, like what I said earlier, they have their own inpatient care units. Again, for my company or for my employer, we have our 12-bed inpatient unit where we send our patients to manage their symptoms. Let's say at home, a patient is having severe pain that they cannot manage at home, then we send them to our inpatient unit. So typically, they say patients can stay there for maximum of 5 days, but obviously, if the symptom is not being managed, then we don't just send a patient away or, we don't just discharge them. Some patients, however, they do pass in our unit and some patients, they go home, wherever their home is.
If patients are released from hospice care and their symptoms worsen at home, can they be enrolled back into hospice care?
But once the patient is in hospice, no matter where they go, they should still be in service unless they move out of town. Let's say here in Nevada, the patient moves out to California. Then we do discharge the patient. Then they have to transfer or enroll to a different hospice company. Also, if they get admitted to the ER, so hospice patients, they can still go to the hospital if they want to. It is their right. If they change their mind or they say, oh, I actually want aggressive treatment, then they can definitely do that. We're not going to stop them. We respect their decision, whatever that may be. And also, they have the right to stop their hospice service. Let's say, oh, I don't want hospice anymore. I think I can fight this, or I want to go to the hospital. I want aggressive treatment. Then they can definitely do that. All they have to do is talk to their nurse and then just sign paperwork, and that's it. They don't have to do anything else.
What is the difference between nursing homes, hospice care, and palliative care?
For nursing homes are like they have 24/7 nurses, CNAs, and doctors and other disciplines. So for them, they actually treat their patients differently from us. So their aim is to make the patient get better. I'm not saying that that's not our goal. Our main goal as hospice care provider is to make our patients comfortable. So we don't do aggressive treatment. However, for palliative care, it is more it's comfort care as well, but they can do aggressive treatment for that. unlike for hospice care, we don't do aggressive treatments such as, let's say, IV antibiotics and stuff like that.
Are there specific requirements, stages, or symptoms patients have to meet in order to be enrolled in hospice care?
Actually, yes. That depends on the diagnosis of the patient. For example, for cancer patients, to be considered appropriate for hospice, is that if the patient's cancer is growing, let's say it's metastasizing to other organs in the body, or if they refuse treatment, or if the prognosis is just very poor, let's say they're not a good candidate of surgery, or even after, let's say they do chemotherapy, radiation therapy, and they're not, getting better, then they are definitely appropriate for hospice. It also depends, like I said, it also depends on the diagnosis of the patient. Let's say, for example, um, uh, let's say COPD, if the patient is on steroids for a long time, then, or the patient cannot walk without oxygen, then that is definitely a criteria where they can be approved for hospice.
Is there an perfect time patients should consider seeking hospice care assistance?
Yes. So the perfect time for patients to seek hospice care is when obviously the doctor thinks that they are appropriate, and also if they think that, obviously if their loved ones or they are suffering from whatever diagnosis they are having, or if again their diseases are spreading or they're not getting better, then it's better to do it as early on instead of waiting till later, because we don't want our patients to suffer, and we don't want our patients to be in so much pain without being managed, or having difficulty breathing without being managed.
What are some lifestyle changes patients can do to prevent cancer?
I would say going on regular medical and dental checkups, also making yourself aware of any family histories that you have, especially cancer. There are so many tests out there that you can talk to your doctor about, and also exercising according to your healthcare provider's recommendation.
Are there any specific foods or food categories the public should avoid that may prevent cancer?
I would say processed foods should be avoided because these can cause, diabetes, obesity, and high blood pressure, which may lead to complications and may lead to more serious complications if left untreated.
Does any specific amounts of fluid intake or water intake relate to cancer prevention?
So, fluid intake is important to keep our body hydrated and healthy, but the fluid intake depends on the age of the person. For adults, drinking at least 2.5 to 3.5 fluid is ideal, but also minimizing alcohol intake as well as high sugar should be avoided to help prevent, other diseases, or help prevent cancer.
Are there any common cancers that are seen throughout the United States and third-party countries?
According to CDC, skin cancer is the most common type of cancer in the United States. But in my experience as a hospice nurse, I saw or see a lot of lung cancer, prostate, and other common. Those are the common uh, cancers that I've experienced or encountered, and those are also the common cancers seen in third-party countries.
Have there been any founded treatments for these cancers?
So common treatments for these cancers are surgeries, chemotherapy, and radiation therapy.
Can breast cancer be found through mammograms?
So actually, yes, um, mammograms can detect abnormalities, and if that abnormality is seen by the doctor, then he or she should usually do another diagnostic mammogram to see the underlying cause of that abnormality and do further tests such as blood work or biopsy.
At what age does one need to seek their first mammogram?
It usually done at the age of 45, but you may do so as early as 40. It also depends if you have family history of breast cancer, then you can do it early on and just talk to your healthcare provider about that.
Can lung cancer be found from family physicians by a stethoscope?
So abnormal lung sounds can be caused by underlying diseases. Thus, auscultation using the stethoscope may help the provider um, catch those abnormalities. So if the doctor or health provider, um, assesses the patient and sees that there is or hears that there's an abnormality, then they can definitely order more specific tests that can catch other diseases.
Are there any other signs and symptoms for these common cancers?
So the signs and symptoms of cancers are different depending on the type of cancer. However, if you are feeling more fatigued, if you're having unexplainable weight loss or lumps that are getting bigger, abnormal skin discolorations and pain that is not going away, or also if you're having trouble breathing, then you definitely have to see a doctor or your primary care so that they can order more or further do some testing.
Does the environment we live in be a risk factor for cancer, especially lung cancer?
Actually, air pollution has said to increase the risk of lung cancer because the chemicals are said to alter the body's DNA, causing the disease that may lead to cancer if left untreated.
How can smoking cigarettes and other alternatives increase the chances of lung cancer?
Smoking cigarettes is the common cause of lung cancer, as well as exposure to secondhand smoke. It is said that the poisons in the cigarette or tobacco smoke alters the DNA of the cells, and also it also weakens the immune system. So it is harder for the body to fight off these cancer cells, so they grow rapidly.
With the pandemic we are all facing today, would it be considered safe to seek hospice care assistance?
It's definitely safe to still consider or continue hospice care as long as the healthcare providers do comply to obviously CDC safety precautions and requirements.
What are some precautions that hospice care is taking to ensure patients and fellow nurses and other professionals remain safe?
As a hospice care nurse, we do provide, my company provide the proper gear such as the PPE, masks, and gloves. We also practice proper hand washing and isolation if we are known to be exposed to any COVID patients, so we don't put our patients at risk. Also, we provide telemedicine where nurses still continue their assessments. So I've been actually doing telemedicine from home. So I still do my assessments via FaceTime or video calls with my patients. And however, some patients they need or they require physical visits from the nurses, and which we do provide. So if that happens, then we do send out a nurse there in person, given that they have all the proper equipment to protect themselves and the patients and their families as well.
If these terminally ill patients are infected by coronavirus, how does the quarantining and treatment process look like?
So we usually get patients who are COVID-19 positive that are already at the hospital, such as the ICU or skilled nursing facilities. But we also have, let's say, we admit a patient who are positive for COVID, then we transport them to our inpatient unit. So with that being said, we do our thorough, isolations, and we make sure that we protect ourselves by using, our PPEs, and we still provide, let's say, personal care and administer obviously their medications as ordered, but we also make sure that before going into the rooms, we have to gather all of the equipment that we need so that it will lessen the exposure, like going back and forth to the rooms and to the med room or supply room.
For our last question today in our interview is, are there any life-threatening signs and symptoms that terminally ill patients experience differently compared to the average person?
Our hospice care patients are not seeking aggressive treatments anymore, so their symptoms may look more severe than those of who are not in hospice care. These symptoms may include difficulty breathing. They may have extreme pain, frequent vomiting, very poor intake, like maybe zero to none, or they could have wounds that are not healing and such, but we still do our best to help them manage all these symptoms and prescribe and administer the medications that are needed to help alleviate the pain and make them more comfortable.
Thank you for watching our interview today. Again, I'm joined with Nurse Ingrid Bail. And if you guys have any questions regarding to hospice care and nursing, you can find her on Instagram at NurseIngridiients. And if you guys have any questions for us, you can find us on Health Needs RX on Instagram as well. Thank you for watching and have a great day.